All right, well, we're going to finish up and follow up with the intro review, which is CPR. Now remember, this test is Thursday also. There's only 25 questions. You've got to make an 84, which means you can only miss 4. That's not my rules, that's American Heart Association. So I'm going to go over this with you and then a really good review. I'm sorry, something in that eye again. Oof. All right, the CPR study guide. When performing infant CPR, you must watch for the chest to rise. And it's not just infant, it's everybody's CPR. You want to make sure the chest is rising. Because if not, you have to open the airway, pinch the nose on the adult and child, and give a breath. Well, if the chest doesn't rise, that may mean you just don't have the head tilted back far enough. And I'm going to show you this much better tomorrow. I'm a dummy, but I am a mannequin, I'm sorry. And if you don't push it back far enough, you don't open the airway, all right? Okay, number 2. When you're with an unresponsive infant who is not breathing with a bag mask and has a heart rate of 53 per minute, what do? Begin CPR with chest compressions. Number 3, when you're doing 2-person CPR for an infant, what method do you use? You use the 2 thumbs encircling. If this was my little infant right here, my little infant, and it's got 2 people doing it. Now, you can't do this with 1. You would have your 2 thumbs encircling, and that's where you would do your chest compressions. The other person is up here at the top doing the breaths, and you're here doing little chest compressions. It's so sad. All right, compression to ventilation ratio. That means it's going to be 2 numbers. For 2 rescuer, infant is 15 to 2. Infant and child, when there's 2 rescuers, the only time it changes, it becomes 15 to 2. What is the correct depth of compression for an infant? 2 inches, or at least 1/3 the depth of the chest. A child has a heart rate greater than 60 beats per minute and a pulse, but is not breathing. What should you do? Begin CPR. 7, when you are a single rescuer and you need to perform CPR, would you use a bag mask device? No. And tomorrow I'm going to show you the bag mask device. First of all, you got to put the mask on and mold it to the face and keep it there. Well, you can't do that. Breathe twice and then go do chest compressions, come back and fix the mask again. No, it's not advisable. You use the bag mask when there's 2 rescuers. Okay, 8, when you're doing 2-person CPR, what is the correct compression to ventilation rate? For the adult, it is 30 to 2. For the child and infant, it is 15 to 2. That's the only time it changes, remember. Okay, when you're using the AED, automated external defibrillator, and have just shocked the victim, what do you do next? You follow the AED prompts. The AED is going to talk to you. It's going to tell you exactly what to do. It will say, shock advised, and then it shocks the victim. And then it'll say, begin CPR or no CPR necessary. So you just follow what it says. Number 10, where do you put your hands for adult chest compressions? On the lower 1/3 of the sternum. Remember, I kind of showed you this yesterday, and it'll be much easier tomorrow when I show you with the mannequins. Lower 1/3, but you want to avoid that little point called the xiphoid process, okay? All right, let's see, 11. The recommended rate of chest compressions for victims of all ages is at least 100 times per minute. So when you hear the Bee Gees going, staying alive, and I can't sing, that's the beat you want to keep it to, all right? Number 12, when you're doing chest compressions on an adult, you should compress the chest to a depth of, again, 2 inches or 1/3 the depth of the chest. 13, compression to breath ratio for 2 rescue or CPR for a child is, I can't hear you, let me see, 15 to 2. Infant and child, 2 rescuer. Only time it changes, 15 to 2. Compression to breath ratio for one rescuer adult is 30 to 2. The adult is 30 to 2. I don't care how many rescuers you have. The adult stays 30 to 2. What is the depth of compression on an infant? 2 inches or at least 1/3 the depth of the chest. Does a victim, now listen to this one, I'm sorry. Does a victim who is unresponsive, they have no breathing and no pulse. Oh my God. Do they need CPR? They probably need an undertaker. But no, they need CPR. Don't say I told you that. No, okay? No, they need CPR. Yes. Okay, let's see. That was number 16. Number 17. Why is it important to press to the correct depth when doing compressions? So the heart will adequately refill. Remember I told you yesterday, you have the victim on a hard surface, not Michael Jackson in the bed. And when you press down on the heart, you want to make sure you're pressing to release the blood from the heart, and then you let it recoil so it can fill up with blood again, all right? And that's the idea of pressing as far as you do. Number 18, this is another one like the 16 before. As soon as you have an AED, what is the first step you do to perform to operate it? If you don't know this one, get out of my class. As much as I love you, get out. The first thing you do is turn the damn thing on. It's not going to work if you don't. You can't just look at it and go, oh, it's cute, put it next to his head and hope it works. No, you got to turn it on, all right? 19, when someone is choking and becomes unresponsive, you will send someone to call 911 and you will begin CPR with chest compressions. In other words, they were like this. And most people, believe it or not, are too embarrassed to let somebody know they're choking. This is the universal symbol. But most people, they always want to whack you on the back. No, forget that. No whacking on the back. It can only make it worse, all right? Or drink something. How the heck are you going to drink something when your esophagus is blocked up? So is the trachea. Anyway, so if they're conscious and then they become unresponsive, that's when you begin CPR with chest compressions. When do you make sure a scene is safe to perform CPR? Well, I'd like to think we're all smart enough to know when you arrive on the scene, you don't jump in and do CPR for 20 minutes and then stand back and go, gee, my feet are a little hot. I guess I'm getting burned from the fire. Really? You think so? So it's when you arrive at the scene. Number 21, when you find, and should be A-N, not A-N-D, an unresponsive victim, and there's no breathing, you should check a pulse for how long. It doesn't matter what the situation is. The pulse check goes on no longer than 10 seconds, all right? 10 little seconds, tick, tick, tick. 22, when you're using the bag mask, you give just enough to allow the chest to rise to avoid gastric or stomach inflation. If you're going to give these big honking mamma jamma breaths, you're going to see not only the victim's chest is going to rise, but the stomach's going to rise a little bit. And you do that too many times, and the patient's dinner is going to rise right through his mouth into yours. I know it sounds gross, but so in other words, don't overextend or distend the lungs. Give just enough for the chest to rise. We're not Superman out here. We're not playing one of these nighttime TV show games, Titans and all that good stuff. No. Okay? All right. 23. When you're giving two persons CPR, the first person starts chest compressions, and the second person does what? The breaths. Okay? In the community, this is out in the open, after you open an airway, you will give 2 breaths. Now, the big thing is the patient, I never told you this, but the patient will, or the victim will exhale on their own. You've got the head back, pinch the nose, and you give the breath. Come up and let them exhale. Don't keep your mouth there and just keep breathing because you're going to distend the stomach. So give a breath, let them exhale. Give another breath, all right? So that's how that works with the inhaling and exhaling. And finally, number 25, when you use a bag mask for a child who is not breathing but does have a pulse, you should begin CPR with chest compressions. Now, I have a little something in the eye here, but we'll try and fix it. How can rescuers ensure they're providing effective breaths when using the bag mask? You observe the chest rising with the breaths. Okay? Just like without the mask. Observe the chest rising. What should you do if you need to use an AED on someone who has been submerged in water? Well, you pull the victim out of the water and wipe the chest dry. All right, while performing high quality CPR on an adult, what action should you do to ensure is being accomplished? Well, what you should do out of your choices is compress to a depth of 2 inches. Now, this is going to be a 53-year-old woman, collapses out in the front yard while doing her gardening. She's unresponsive, not breathing, and doesn't have a pulse. A neighbor who is an emergency medical technician goes over. When the AED arrives, what's the first step to do when using it? Please get this right. Look, you're giving me extra wrinkles, like I need that. Turn the damn thing on. Well, it doesn't say damn thing. It just says turn it on. When the AED pads are attached to the victim's bare chest, the AED detects ventricular fibrillation. What is the next step in using the AED? Follow the AED prompts, or follow what the AED says for you to do. By the way, the AED is in English and Spanish, Espanol. Okay, what ratio for compressions to breath should be used for one rescuer infant CPR? One rescuer infant, 30 to 2. 30 to 2 on the adult, 1 or 2 rescuer. 30 to 2 on the infant and child, 2 rescuer. If it's 1 rescuer on the infant and child, it's 15 to 2. What is consideration when you're using an AED? On a hairy chest, the pads may not stick, and so it won't deliver a complete shock. So you're doing no good there. All right. A 9-year-old child has suddenly collapsed. After confirming that the scene is safe, a single rescuer determines the child is in cardiac arrest, shouts for help, and activates the EMS system. He immediately begins performing high-quality CPR. Now, 2 additional rescuers arrive to help. What actions should occur next to support a team-based resuscitation attempt? 2 rescuers should alternate, giving high-quality chest compressions. All right? You should alternate because somebody's going to get tired. Also, the 9-year-old little boy or child. 2 rescuers begin that high-quality CPR while the 3rd rescuer leaves to get the AED. What action supports 2 rescuer CPR? Again, alternating the compressor roll every 2 minutes because you're going to be doing CPR until the ambulance gets there. This is just one link in the chain of survival. And if you can't do this one right, the rest of them aren't going to matter much. All right, this is that in the hospital kind of thing. Team members. Members of the team know their boundaries and ask for help before the resuscitation attempt worsens. Match the statement with its most appropriate element of team dynamics. Is it knowing and sharing? No. Is it summarizing and re-evaluation? You never heard those words come out of my mouth yesterday. Is it constructive intervention? No. Oh, what about knowing your limitations? Know those before. Look, if you are a petite person and they want you on the team to do chest compressions, let them know. I'm tiny. I don't know if I can press that hard, okay? Without severe amount of practice. Not hard, but press that deep or deeply. So if you have a limitation, let them know about it beforehand. After is not the time to do it. All right, a victim of a foreign body airway obstruction, FBAO, remember that? Becomes unresponsive. Evidently, they were responsive, going, now they're unresponsive. What is the first course of action? Start CPR beginning with what? Let me see this here. Chest compressions. Yes, I heard it better out of that here. Sorry. Okay, why is defibrillation important? Because it can restore a regular heart rhythm. We're not going to just shock somebody for the hell of it. It can restore the normal sinus rhythm or normal heart rhythm. You witness somebody suddenly collapse. The person is unresponsive, has gasping sounds, and there's no pulse. What should you do next? Like everything else, begin CPR because gasping is not normal breathing. Got it? Okay, here's a scenario. A middle-aged man collapses, and you and a second rescuer go to the victim and find that he's unresponsive, is not breathing, and doesn't have a pulse. What action is most likely going to positively impact his survival? Yes, performing high-quality CPR. Same guy. You and another rescuer begin CPR, but after a few cycles, you notice that the chest compressions rate is kind of slowing down a little bit. What should you say to offer constructive feedback? Say, well, you need to compress at a rate of 100 to 120 per minute. Okay? Now look, adrenaline's going, everything's going, so you may do it louder and more earnest than that. All right, how do you perform chest compressions on a child victim? All right, same thing. You compress at least 1/3 of the depth of the chest or 2 inches. When performing CPR on an unresponsive choking victim, what modification should you incorporate? Each time you open the airway, when you're doing the head tilt, chin lift, look and see if you can see the obstructing object. Because you know they were choking because they were doing this. Then they became unresponsive. So every time you do the head tilt, chin lift, look and see if you can see what's down, if there's anything down there. If you don't see it, you don't do a blind finger sweep. Okay, here's your little story. Oh, an 8-month-old is eating and suddenly begins to cough. Oh no. The infant is unable to make any noise shortly thereafter. You pick up the infant and shout, "Help!" Okay, you've determined that the infant is responsive and choking with a severe airway obstruction. How do you relieve the airway obstruction? You're going to give 5 sets of back slaps and chest thrust. Here's the baby. Support baby. Baby space down. 1, 2, 3, 4, 5. Way up between the shoulder blades. Support baby. Make a baby sandwich. Flip baby over. Same place you did CPR. 1, 2, 3, 4, 5. Tongue jaw lift. Do you see it? Sweep it out. Otherwise, keep going. Just keep doing it until help arrives. All right, the same scenario with the baby. Which action do you perform in relieving a choking in an unresponsive infant? Perform CPR and look in the mouth for the obstructing object. Which victim requires high-quality CPR? Somebody that's unresponsive with a strong pulse? No. Somebody who's responsive, has a pulse, but's just having trouble breathing? No. Somebody who's responsive, having trouble breathing, and has a pulse less than 60? Nope. The person that needs high-quality CPR is a victim that is unresponsive and with no normal breathing and no pulse. I mean, these people are like 1 foot on a banana peel, 1 foot on a grave, all right? Okay. Here we go with the team functions again. The team functions smoothly when all team members know their positions, functions, and tasks during a resuscitation attempt. The statement that most appropriately is an element of team dynamics is it mutual respect? I mean, you're supposed to respect each other, but it has nothing to do with CPR. Constructive intervention? No. Knowing your limitations? That's one of them, but what's better is clear roles and responsibilities beforehand. Clear roles and responsibility. Why is allowing the complete chest recoil important when you're performing CPR? The heart will adequately refill between compressions. Look, if you're pushing down this much, but only coming up this much, and pushing down, eventually the heart's going to be so filled with blood, you're not going to be able to push it down. And what good are you doing anyway in the meantime? All right? Not much. Okay, here we go. Let's see. 67-year-old man, unresponsive, not breathing, and no pulse. Okay. When should rescuers switch positions during CPR? They should switch every 2 minutes. Okay? And who calls for the switch? The person doing the chest compressions. You notice the person giving the chest compressions is not allowing complete chest recoil. What should your next course of action be? Tell the compressor you notice a decrease in chest recoil. They're pushing it down but not letting it up all the way. Or if they're slowing down with their compressions, you got to go a little faster, a little bit. Most people, by the time they get to knowing CPR and have done it, they're pretty good. But you still keep an eye on it, all right? And finally, rapid defibrillation is a link in the adult chain of survival. Why is this important? Because it eliminates the abnormal heart rhythm. You don't want the heart to be fibrillating, all right? So you get the defibrillator, and that's what we have at school. I'll show you tomorrow. It's called an AED, all right? That's it, my loves. So I will see you all at school tomorrow at 9 o'clock. Love you.